second year MSLP student Samvaad. I am going to take a therapy session for Akshat. I am working on the comprehension and expression of prepositions. So we'll start the session. Akshat, say hi.
Hi.
Yeah, my name is Akshat.
My name is Akshat.
Yeah, okay. Say hi to Bhaiya.
Hi, Bhaiya.
How are you?
Hello.
Akshat, where is the ball? Show me ball. Now keep the ball. Yeah, wait. See, keep the ball behind the cycle. Yes, good boy. Okay. Now keep the ball. Wait, keep the ball in front of the cycle. In front of the cycle. Where is the ball? No, that's wrong. No, that's wrong. Keep it here. Yeah. Wait. Where? Yes. Now keep the. Wait. Listen properly. Keep the card in front of the ball. Where is the card? Wrong. This is wrong. Okay. Now Akshat will do. Akshat's turn. Ready? Akshat's turn. Yes. Keep the cycle. Akshat, look here. Keep the cycle in front of the ball. Keep the cycle in front of the ball. Keep it here. Yes, okay. Now show me ball. Listen. Okay, we'll turn and keep it like that. Yeah, good boy.
ಸ್ವಲ್ಪ ನಿಯರ್ ಅಬೌಟ್ ಕೆಲವು ಬುಕ್ಸ್ಗಳನ್ನ ಕಾಣುತ್ತಲ್ಲ.
आपको अभी क्या प्रॉब्लम है?
कानों से थोड़ा कम सुनाई देता।
कब से?
हो गया करीब 1.5 साल।
1.5 साल। ठीक है। अभी आप टीवी देखने के समय आपको थोड़ा बहुत कम वॉल्यूम ज्यादा करना पड़ता है। ठीक है। अभी हमने एक टेस्ट करेंगे, टेस्ट करके देखेंगे। ठीक है। अभी इसके लिए मैंने आपको एक हेडफोन्स लगाऊंगा आपको कान पे। ठीक है। उसमें हेडफोन से आपको थोड़ा आवाज आएगा। ठीक है। कोई करके आवाज आएगा। आपको कभी कभी ये आवाज सुनते हो उस टाइम पे आपका ये इसको प्रेस करना पड़ेगा। ठीक है। करके छोड़ना है। ठीक है। कभी आपको आवाज आएगा, आप वो आवाज को सुन लिया तो इसको प्रेस कर लीजिए। ठीक है। ओके। अभी आप कंफर्टेबल हो?
हाँ।
कुछ प्रॉब्लम नहीं है?
नो प्रॉब्लम।
ठीक है। कुछ दर्द नहीं हो रहा ना?
नहीं, कुछ ठीक।
Okay, now we are doing an audiometry which is called as pure tone audiometry. This is the basic level of hearing testing. This basically uses, in this we are trying to check the patient's type and degree of hearing loss. If he is having a hearing loss, we are trying to find out how much his loss is, what percentage his loss is, and what kind of loss it is, because of what reason he is having a loss. So we'll be able to, this is a primary and the basic test, but it gives us a information, gives us a very vast information, and the test which comes after this all depends on this particular test. So this is a very important test in audiology.
An audiologist. I completed my masters from Mysore University and All India Institute of Speech and Hearing in 1987. Why I took this course? Everybody asks me why I took this course. I took this course because I was interested to treat people. I wanted to be in the health sector and be there to treat people who have any health issues. But I was very clear I didn't want to be a doctor. that I couldn't handle the blood and seeing different patients. So I was looking for a field that helped me do treatment but not with that medical condition. So that's how the paramedical field attracted me. And I chose speech and hearing because we work with children. And I have a passion to work with children. And you are, as a teacher and as a doctor, you have to treat this child. That is what attracted me to this field, because when you get a child who's got a speech disorder, you have to first identify and diagnose what is the problem. Why is the child not speaking? So, and then we have to, as a teacher, plan the treatment for this child and implement the treatment program and bring this child to a normal level. So all these factors is what attracted me to this field. And I have no regrets for having joined this field. Of course, in the early years, 20 years, almost 1987 to even 2000, there was no recognition for this field. But I enjoyed my work, and today I am happy that in today's generation, there is a lot of money in this field. Finally, recognition has come in this field, but our generation for 15 years, we did not see money. But today's youngsters who join this field have a good career, and the starting salary for a BSc student is about 18,000 rupees, and for a postgraduate is 25,000 rupees. So it's a very good career for people who are interested in the health sector. The job opportunities in India and abroad are also very good. In 2005, I started this institute, Samvaad Institute of Speech and Hearing, with the main objective of providing service for all speech and hearing disabilities in Bangalore North. Because at that point of time, whether it's a rich man or a poor man, there was no service available in this part of Bangalore. I have a private practice in Indiranagar, and I was having a very good clientele, but I didn't have enough hands to help me. Because in our field, we need one person can see maybe 6 children in a day, or 6 therapy cases. We cannot see like doctors every 5 minutes on one case. So we need to spend quality time with everybody. So I realized that there is a great shortage of professionals in the field, and government colleges were not coming up. So when I said let us get together, so we colleagues, friends got together, and we started this institute in 2005 with the second objective of training professionals. We all have 20 years, 25 years experience in the field, so we thought we are ready to teach and pass on this knowledge that we have to the next generation. So with those two objectives, we really started this institute. Today we are 6 years old, and 4 batches of speech pathologists and audiologists have passed out. About 30 children have passed out, and we have got the first rank in Bangalore University for 3 years in a row. And all our all our students who have passed out have all got jobs. Few of them, about 10-15% are doing their masters. The rest are all working in the community, in different hospitals, in special schools, in private clinics. So they're all gainfully engaged with that problem. So stammering causes a huge embarrassment for the child as he grows up and becomes an adult. And if he cannot say "r" and he says rabbit for rabbit, or as an adult it sounds very bad, but as a child it sounds cute. But none of us would have wanted to want to have a speech defect, because today's age communication is so important. So we correct stammering, we correct mispronunciations of sounds, and we also deal with serious disorders like mental retardation that used to be called earlier. We call it cognitive delay nowadays. And we call them children who have mentally challenged children. Because of the lack of mental ability, they do not learn to communicate very well. So they need our help to improve their communication skills. They will speak in broken languages, or they will not understand if you tell them 2-3 things together. So they need training to be able to live a normal life. We deal with children who have born with a brain damage that prevents their hands and legs to move. It is called cerebral palsy. So cerebral palsy children have a lot of motor movement difficulties, their tongue, their lips, all of them do not coordinate, so they can't speak very well, can't speak clearly. So for those children, we look at alternative methods of communication, where there will be a board in which there will be pictures, and we teach the child to point to the pictures. Some cerebral palsy children are very intelligent, they learn to read, and so then they put them, and they can go onto the computer, and we modify the computer so that they learn to communicate using some method of communication, because communication is our birthright. As human beings, we want to communicate, we have that inner need to communicate. So our role is very important in families which has a child which has any kind of communication disorder. The other type of disorder that we deal with is autism. In autism, children have very three main characteristic features. And one is that they are not interested in socialization. So by the age of 3, children should be talking to people, asking questions, asking for what they want, playing in a creative way, and communicating beautifully. But children with autism don't learn language at all. They don't learn to ask for what they want. There will be a bottle of milk and the child will just cry. He cannot say, give me the bottle. But if he sees a picture of Pepsi, he will say Pepsi. So it is a very odd behavior that happens. A child will label all the advertisements that happens in the house, but he will not be able to ask for what he wants. So these are the characteristic features of a serious disorder called autism. And then if you identify that, you can set it right and make it balanced and get all aspects of language to develop in an even manner. So we have children who have come to us with severe behavior problems. They don't want to sit with you, they don't want to interact with you, because they don't know what to communicate. They don't have the communication tools. So we have to start from scratch and teach them how to use words to get their needs. Because the frustration and all the behavior problems in most children is due to lack of communication. And if they cannot ask for what they want, if they want to say, I want to go out and use their music at home, and that's why that creates a big temper tantrum. So we teach children how to ask for what they want and how to answer questions, how to ask questions. So in autism we get help, the children get a balanced development in all aspects of language. In adults we deal with people who had a head injury or who had a stroke, because the brain is the center of language development. So you can be a normal speaking person, and if you have a head injury, your language speaking ability, your speaking ability can be severely impaired. Very few people, it's a very rare condition, but if it happens, it is devastating. Because this person for 1 minute he is talking very well, he has a stroke, and the next minute he can't even say his name. So it is very traumatic for the family, and we deal and reduce the impact of the problem and give them training so that basic communication skills are developed. And we try our best to see that these patients can get back to work. We also deal with patients who have cancer of the voice box. So they have to remove their voice box because they have cancer, and we teach them alternative ways of communication. We deal with adults who have voice problems. There are boys who have female voice and they think that they can't be rectified and they live with that embarrassment all the time. There are one boy from a software engineer who called me and said, ma'am, people when I pick up the phone they say, hello madam, and I'm feeling very embarrassed, can you help me? I said, sure, and within 1 week we can treat him. So his embarrassment that he lived for 30 years, in 1 week he is solved. And without any surgery, without any problems.